Today, we're diving into the core elements of national policies for digital health technology, or DHTs. It's a field that's quickly growing but faces unique challenges. To start, why do you think DHTs have such an impact on healthcare outcomes?
Well, DHTs really provide personalized care at scale, which is crucial. They have the ability to optimize a patient's health, improve the efficiency of clinicians, and even reduce overall healthcare costs. But the issue is getting them into healthcare systems effectively, right?
Absolutely. It seems like there's a gap when it comes to market access. Even with regulatory authorization, DHTs aren't necessarily accessible to patients without clear pathways for reimbursement and pricing.
Right, and that's where the full-stack policy approach comes in. It's a comprehensive framework that includes regulatory authorization, value assessments, pricing, reimbursement, and patient access infrastructure. This approach is what's needed to make DHTs widely available.
Exactly. And different countries are experimenting with this. For instance, Germany has a digital health application infrastructure, but even there, barriers still exist, like clinician awareness and the requirement for prior educational conversations.
That's a great point. It's one thing to approve a digital health tech, but it's another to ensure that everyone in the system is aware of it and knows how to use it properly. How do you think we can make this process smoother for patients?
Education and infrastructure are key. If we don't integrate proper training for both clinicians and patients, the technology won't reach its full potential. And on top of that, we need consistent clinical evidence requirements across jurisdictions to increase scalability.
That's the challenge, isn't it? Without consistency, a DHT could be approved in one country, but face a completely different set of criteria elsewhere. Standardizing these requirements would help the technology scale faster.
Definitely. And it's not just about clinical outcomes either. Some DHTs improve patient literacy and help patients manage their own conditions better. These factors could be just as valuable as clinical results.
Yes, and that's something Germany has started incorporating, recognizing the broader impacts of DHTs. But we still need more global collaboration to define clear evidence standards that are flexible enough to be applied universally.
Absolutely. And as more countries adopt these frameworks, we'll hopefully see greater integration of digital health tools. The goal should be a system where DHTs are part of the healthcare fabric, not just an afterthought.
Exactly. And we can look forward to seeing how global initiatives like the DIME project work toward aligning regulatory pathways. It's about making sure that digital health technologies aren't just innovations. They're accessible solutions for everyone.
And that's the big picture, right? With the right policies in place, we could transform healthcare into something much more tailored to individual needs. It's all about integration and scalability.
That's where the future of healthcare is headed, using DHTs to create a more personalized, efficient, and cost-effective system. Let's hope the policies catch up to the potential.
Couldn't agree more. It's an exciting time for digital health, but it's going to require some smart policy work to make it all come together.
Definitely. So what's next? How do we start seeing this full-stack approach in action more globally?
That's the million-dollar question. It's all about aligning those four components: regulation, value assessment, pricing, and patient access. Once those pieces are aligned, I think we'll see a much smoother integration of digital health tools worldwide.
Agreed. Well, I'm excited to see how this all unfolds and how it might change the landscape of healthcare as we know it.